morning, good afternoon, good evening, everybody, and welcome to another week of the Global Café. My name is Elizabeth Lewis, and I'm a Senior Project and Policy Coordinator here at the IFA. I'm very excited to be introducing you all to Dr. Stephen Verderber to discuss equitable places for older persons to live and recent advances in evidence-based architecture. Dr. Stephen Verderber is a registered architect in the US and a co-founder of R2ARC, Research to Architecture, Inc. He is the sole author of 7 books, co-author of 2, and has published over 100 peer-reviewed scholarly and professional articles. His most recent books are Innovations in Transportable Healthcare Architecture, Innovations in Behavioral Health Architecture, and Innovations in Hospice Architecture. His first book, Healthcare Architecture in an Era of Radical Transformation, has become a standard reference. Principal investigator of numerous externally sponsored research projects and reports, he holds one of only 2 North American faculty cross-appointments linking architecture and public health. Dr. Verderber has developed invited keynotes and numerous international conferences on evidence-based health research and design, education pedagogy, human health-centered design, and has received numerous awards for his interdisciplinary contributions to the advancement of the discipline, profession, and broader community. His most recent book, Architecture and Health Equity in an Imperiled World, will be published in the Johns Hopkins University Press in spring 2005. So thank you so much. As you can tell, Dr. Verderber has quite the stacked resume, and we're very lucky and privileged to have him here with you today. So welcome, and very excited to talk. My first question before we speak about equitable living spaces for older persons, I want to get just a bit more information about yourself. So my first question is, what ignited your passion in the field and how did you get started?
First of all, thank you for having me. This is great to be able to be here to speak with you. Um, I, um, I became, when I was in graduate school at the University of Michigan, I was in an interdisciplinary program, a PhD program, and I was in my home was architecture academically, but my home away from home became public health and psychology. And one of my advisors was an environmental gerontologist, and his name was Leon Pastelin, and he had worked with M. Paul Lawton at the Philadelphia Geriatric Center. And M. Paul Lawton was one of the leaders, if not the main pioneer in environmental gerontology in North America. And he proposed some very important theories that still make so much sense today. But this is many years ago now. And Dr. Pastelin had put together something called the empathic model, which was a simulation device to train architects to become more aware of the particular needs of older people who experience cognitive and physical deficits. And so he created a kit that the architecture students could wear, and we have obscured glasses to represent different vision loss. It could be cataracts in one eye or the other. And so glasses could be coated, obscured on one side or obscured on the other, or slightly fogged. And then there would be restrictions for the hands and on the legs, maybe. And some would be required to walk with a cane. Others would be required to be in a wheelchair. And so and various different conditions or scenarios could be established for different students. And so the students would negotiate a route in the architecture building or on the campus for a period of an afternoon, maybe 4 hours or so. And this would have a profound impact on people's perception of what it's really like to be in someone else's situation, quite different from their own, from students who are in their 20s compared to someone who would be quite older. And and in almost every case, the students were very appreciative of the experience. And in fact, when I was at later on, when I became a faculty member myself, periodically I have my own students do the same thing. So I have about 10 of these kits that I've made myself. They're not all that difficult to create. And once we were on CNN, we were featured on CNN for going through a hospital campus in an
Mm.
afternoon, and the camera crew followed us and then interviewed us afterwards. So this is one of the first experiences I had with designing for older people. It started in graduate school.
That's very fascinating. That just sounds like a very unique and insightful experience. So thank you for sharing that with us. And although our audience members have likely heard of, sort of age-friendly framework through the work that we do here at the IFA, could you help set the stage for us all by explaining, in particular, what evidence-based architecture for older adults really means?
In a nutshell, it is about gathering evidence from, in other words, having a knowledge-based professional practice, so that rather than working on intuition or working on off of just time-proven
Mm.
assumptions about how buildings should look and function and how people would function within them. It's about gathering actual information in the field through interviews, surveys, observation, um, research studies that
Mm.
might involve qualitative or quantitative research. And it could be often in the basis of what's called a post-occupancy evaluation, where a firm or a consulting firm will come in and evaluate, for instance, a long-term care home after
Okay.
it's been in operation for a period of months, maybe 6 months or a year, and then assessing its strengths and weaknesses and opportunities for improvement in four areas: in the aesthetics and ambiance, the maintenance and upkeep, environmental control systems, and the
Mm.
functional day-to-day support that it provides to the residents. And so the evidence that can be created from a post-occupancy evaluation can then be carried in to the next
Mm.
design project, so that hopefully the same mistakes aren't being repeated. And so this is a field within architecture that has been around for about 30 years.
Okay.
Um, and there are books on it, and many research studies have been done surrounding evidence-based design.
Thank you. Thank you for sharing a bit more about that. And in terms of the considerations that are made in infrastructural design, what is considered to ensure that a physical space meets the needs of older adults?
What it has to be, and older adults, as I mentioned a few minutes ago, is to design for older persons
Hmm.
requires in thinking empathically, first of all. And so things that most younger people take for granted have to be very carefully considered and orchestrated in a building. And one of the main things is not providing too much sensory overload or underload. In other words, the environment has to be optimally supportive from a standpoint of being attuned to a person's physical and cognitive abilities and not being too challenging for them. Because then they'll turn off. For instance, in a long-term care home, it might mean someone being unwilling to leave his or her room because maybe it's too difficult to navigate a hallway or a staircase, or having to leave the building to go outside to get to another building.
Hmm.
And a lot of this revolves around the issue of wayfinding.
Hmm.
There's a significant literature in environment and aging. The field is called environment and aging in general, that encompasses architecture, landscape architecture, interior design, industrial design, um, in particular. And environment and aging, one of the main areas is wayfinding. So there have been the first book on wayfinding, I think, was published in the mid 70s by Raimondo Pacini, who was a professor at the University of Montreal, and it was called Wayfinding in Architecture. So this area goes back to the mid to late 70s, and
Hmm.
wayfinding is about making buildings legible and able to be comprehended without too much difficulty for people who may suffer sensory or cognitive deficits. And wayfinding means having clear paths, informative signage without being too confusing, maybe the use of color-coded surfaces, different textures, changing floor surfaces, and lighting conditions. For instance, in a long-term care setting or an assisted living facility, for it to code individual resident bedrooms along the corridor, you might have different carpet colors, like the color around the threshold to your room might be a different color or a different material. And that helps with wayfinding and orientation. And then that can be redundant cued with a memory box in a memory care unit, for instance, which is mostly inhabited by persons with various stages of dementia. You redundant cue the environment so that the wayfinding cues and the memory triggers are all choreographed together in the architecture so that it becomes as navigable and easy to comprehend and recall where one is spatially
Mhm.
within the building, no matter where it is, inside or outside. Even if it's in a garden, in a secured wandering path, that there should be, it should, the wayfinding is important, places to sit, um, being able to maintain an idea of where you are to the maximum
Mhm.
extent and how you got there and how you can get back to your residence or back inside the building. All these things are part of what's called redundant queuing, which is a very important concept in environment and aging. It's one of the core concepts, actually. It's called redundant queuing. That
Mhm.
means basically present the same information in multiple ways.
Okay. Yeah, no, thank you for sharing on that. There's a lot that gets considered in making sure to design suits the needs of older adults.
Mhm.
In line with that, are there any sort of criteria or guidelines or something that would sort of inform whether a space is designed with the intentions of older adults, or maybe things that wouldn't be considered?
You mean in what are you asking about if a certain, let's say, apartment building is
Hmm.
designed for people who might, and they're without thought to the particular needs of older persons? And then
Right, yeah. Ye-
there these we're because of the rapid aging of so many societies around the world,
mm,
there's a phenomenon called naturally occurring retirement communities,
mm,
meaning that they weren't designed as such for older persons, but as we age, they're becoming occupied by more and more people who have more physical and cognitive needs, and the physical environment is not connected. There's a disconnect. And in a
mm,
naturally occurring retirement community, sometimes the deficiencies or the degree of mismatch can be quite significant. So that,
mm,
for instance, one basic example is bathrooms that have no grab bars and have no pull cords or no redundant queuing in a bath or shower space because they were designed for people 20s, 30s, midlife without any consideration that people will age. And so there has to be so much retrofitting that's going to have to occur around the world in housing to make it more suitable so that the degree of mismatch can be minimized.
mhm. And is that some of the work that you do as well as an architect and in retrofitting spaces, or coming in and seeing where changes can be made as well?
Yeah, yes, this is very important to be able to go in to if you can well, people don't even a lot of times they don't the term is being used by gerontologists, this term I'm using,
Mm,
and they so there's going to be a lot of retrofitting that's going to have to occur of
mhm,
existing housing because it's so expensive to build brand new. So it
mhm,
doesn't just make more sense to try to renovate or retrofit what
mhm,
already exists if it can be done. Now, with single family homes and certain other types of multifamily housing, they have steps up to the front door, and we need to be able to modify to allow for wheelchair access. And
mhm,
there are different ways to design for wheelchair access for a private residence that can be more aesthetically suitable to the building.
mhm.
If a consultant or an architect is brought in with more design expertise about how to do that.
Mm.
rather than just having anybody come along and construct something which might be
Right,
completely out of character with the building and stick
right.
out. But this is all this is all part of retrofitting. Also,
Mm,
lighting is very important
mm,
inside and outside because the spaces need to be safe and defendable. And
mm-hmm.
safety is another whole discussion about designing for safe environments and secure environments for persons, which will require a lot of retrofitting.
Absolutely. And I think you've touched on this a bit in what we've said so far, but I want to explicitly mention, like Canada, many countries are facing a housing crisis and lacks a suitable and affordable housing for many demographics. Where do the needs for creating housing for older adults or those with physical impairments fall or fit into this puzzle piece? I know you mentioned retrofitting as being of a huge importance, but how do we make these considerations and how does that impact the housing crisis?
Well, there is in Canada, there are a lot of homes that are under-occupied. There might be only one person living in a relatively large house with four bedrooms, and and that and it's ill-suited because maybe a widow lives in the house
Mm,
and she's 85, 88, maybe 90 years old and doesn't want to go to a long-term care facility or may not need to go still. But the minute that she falls and breaks her hip, that environment becomes completely dysfunctional.
mm,
And so there is a opportunity to, and if she has to relocate to a term care home at that point after having a hip replacement, it might be very difficult to ever return home. That house goes on to the market, and that house with four bedrooms now can maybe be more fully occupied. And this is one way to solve the housing crisis. But the problem in Ontario and Canada in particular is that there are 41,000 people on the waiting list. I think the number might even be higher now,
wow, okay.
um, waiting to get a bed in a long-term care facility. And the
Mhm,
waiting list are 5 to 7 years in many cases. And you might pass away before you're ever accorded a bed in a long-term care home. And so
mm,
there's a push right now in Ontario to build 30,000 new long-term care beds in facilities. And until that can happen, there's a bit of it's a bit of a gridlock situation because
mhm,
people who might be able to relocate or would willingly to a long-term care option, I don't have the option, so they're staying at home and they're tying up houses that could be occupied by families.
mhm, mhm.
This is
And
just one facet of it.
it's certainly a complex problem. And I see Grace's comment in the chat here saying 45,000 plus on the waiting list for long-term care in Ontario. So certainly a large issue that needs more resources allocated to it.
Mhm.
I see some other good questions in the chat here, so I'm going to take a moment to have some engagement from our participants. Elizabeth, you have a great question here. If you want to unmute, you're welcome to read your question. Otherwise, I'm happy to read it for you.
Oh, thank you so much. And thank you for allowing me to eavesdrop into this conversation today from New York. I'm actually an emergency manager, specializing in marginalized population issues in all four phases of emergency management. So I'm looking at this particular very interesting topic from the perspective of the spectrum of age, but also spectrum of disability as well, along with other marginalized population concerns. And specifically, the question I posted, could you speak to that intersectionality of the concept of universal design in the built environment and how these concepts, what you're speaking to as well as others, are incorporated into the education of architects, designers, etc., so that instead of being a retrofit, instead of being an afterthought, instead of being something that's put in place when there is an unfortunate opportunity to do so. It's done on the front end or baked in, if you will, so that these concepts actually become commonplace without even recognizing them as something different or unique. And I'd be interested, in addition to that, if you have any examples of jurisdictions that might have rules or regulations to produce that outcome when there are opportunities. So again, whether it's the carrot or the stick, how do we get to the same end result? Thank you so much.
Well, it does have to do with policy, and it's public policy. And in some ways, it's slightly beyond the realm of architects to be able to form those policies, but we can inform the policies without necessarily having the wherewithal or the responsibility bestowed on architects to actually create those policies to ensure universal design. Now, universal design is essentially, in its most generic definition, it's about designing a given space, a given building or outdoor space or intermediary space for the least capable individual and the person who might have the greatest difficulty navigating that particular space. And so it goes very carefully. It's very much rooted in the concept of redundant queuing and maximum accessibility for all. And what happens is that a lot of times developers want to meet the minimum standards, and the minimum standards don't go far enough in terms of universal design. They tend to design for a particular market segment because so much of what developers build is market driven, of course. And whatever that market is where they're gearing their efforts. And the architects are being directed by their clients to do so accordingly based upon that particular market segment. So if the segment is for older persons that is being designed for, then it's very likely that universal design will become very important from the very beginning. Otherwise, no. It might be an afterthought. It might be just pushed aside, or they say, we don't have money for that because they found a way to say, we're going to add 10% more to the building and to the landscape design if we have to make it universally designed. And so this is very unfortunate, but only public policy can help to change this across a broader spectrum of markets, target markets, and socioeconomic levels, and racial and ethnic backgrounds in communities of different socioeconomic status. It's a very complex problem. But there is the first big major book on the topic was written by the late Wolfgang Preisser. It's called the Universal Design Handbook. It's a very thick book. It's in its second or third edition right now. It's called the Universal Design Handbook, and it addresses the broad spectrum of scales of the built environment, from the urban neighborhood scale to the scale of a building and its immediate context from the standpoint of universal design. And there is a section in the book on legal aspects and ethics in the legal aspects of universal design as well, which are a topic unto themselves.
And just as a quick follow-up, these concepts of design, how rooted are they in the education of, I'll just say, architects in this case? I mean, is it something that somebody who graduates with a desire to enter this field generally has at least touched on, at least scratched the surface, or is it something you come to later on if you have a need or a desire?
No, this is mostly anecdotal because there are no statistics on this. Your question would be one that would really need to be studied in a quantitative way. And for instance, on an exit interview of students when they graduate. But I would say that maybe only 10 to 20% of architecture graduates are ever exposed to this, anything that we're talking about while they're in school. I'd say 10 to 20%. And it just depends on the particular university or college. And most gravitate towards it after university training. after they're out in practice. This is the experience in the United States and Canada, where I have where I'm based, basically, both these countries. And so they take a position in a firm that focuses on healthcare architecture, and they then become immersed in all of this, and they'll come back to me later, 4 or 5 years later, and say, why didn't we study this in school? We should have, but we didn't. And I'm getting the same kind of response now with the fact that architects are just terrible first responders after disasters. And be it hurricane, um, urban wildfires, all these different types of disasters that are occurring with more frequency, architects receive very minimal training in how to respond in an anticipatory way. And so as a result, architects have been branded as being very terrible first responders. And the engineers in particular, civil engineers, have taken the lead in disaster response in many cases and pushed architects aside. So these are two areas that are really worrisome to me. We need to improve education in disaster response and in designing for special populations such as older persons.
Thank you so much, and hopefully that answers your questions there, Elizabeth. I know we have some other great questions in the chat. I do have one question while we're still on the topic here. We discussed just a tiny bit there about the impact of disaster and, climate change or politics in shaping design, but I'm wondering if you could be a bit more explicit on how these factors and environmental disasters in particular um, shape the planning process for architects and what is being done.
You mean for well, architects are getting better at this,
Mm.
at responding, but still have really no answers. The problem is that the perception of the architect is that the architect um, it wants to take too long. The building has to be, quote, perfect, and it has to be aesthetically sophisticated. And none of these are conditions that just don't exist in disaster response. There's no time. Things have to be done very quickly. And sometimes aesthetics take a very, very distant back seat to the reality of the day-to-day urgent needs of the victims of disaster. And so architects have to, it's going to require a change of mindset for architects to be able to respond in an anticipatory way. And it's a real problem still, because in school, the students are still taught the way it's been done for 50 to 75 years, and that we're in a changing world. In other words, in so many ways, I know all of you are very um, aware of these issues and have probably very, very extensive backgrounds in various aspects of working with older persons and their concerns. And in terms of architects, it's just it's just a question of the fact that we are in a 21st century world right now. And a lot of the curriculum still that guides the training of architects is based in 20th century realities, namely the climate and infrastructural realities. But it's all new, it's changing. And the curricula have not evolved to the extent that they need to. So there's a terrible game of catch up being played right now. And the best architecture schools are the ones that are rethinking their curriculum to consider these issues and the importance of infrastructure and how architects have such an important role in creating a 21st century infrastructure. And how, for instance, in the case of the California fires recently, the wildfires in LA,
Mhm.
and I saw a piece on a national TV show in the States last Sunday on the Paradise, California, was devastated by a terrible wildfire about 4 or 5 years ago. And they're rebuilding their homes to be as fireproof as possible. And this is a good example. If and they're working with new shapes that might even look like Quonset huts in some cases, so that the embers fly over They pass
Interesting.
over the roof and they don't get caught in the eaves, and they light and ignite the roof from within. There's and thicker walls and different materials, and thinking about the clearing the brush and the immediate environs around the houses. And these are the things that we need to be retooling the curriculum for in the architecture schools. And in
No.
the case of healthcare, I was in I was teaching at Tulane University in New Orleans in the States during Hurricane Katrina. And so my home flooded, and
Mhm.
we were so I've been a victim of a major disaster that was in 2005. And we were out of the house for 4 months, living in Austin, Texas. And my kids were in high school at that time. And and it was highly disruptive. So what happened was they rebuilt the big charity hospital in downtown New Orleans was rebuilt with federal funds on a new site. And the whole hospital is about 4 meters up above the where the flood line was in Katrina.
Mhm.
And so all of the main this is an example of how architects in a need to be retooled to think about infrastructure. By raising the whole hospital was raised up, the replacement facility. And this is something that nobody would think about normally. Like, why would you want to raise a whole hospital four
Right.
meters up above
Yeah.
ground? Well, we never did that before. That was never
Mhm.
done in the 20th century. But now we have to. In more and more coastal regions around the world, we have to rethink, we have to make our healthcare facilities more resilient. Every type of healthcare facility, hospitals, long-term care homes, outpatient clinics, everything,
Mhm.
pediatric facilities, psychiatric hospitals, rehabilitation hospitals. I mean, I have some background on all of these building types, and I'm particularly concerned about the need to rethink architectural education as well as architectural practice from a 21st century perspective in the climate crisis.
Mhm. No, thank you for sharing that. That definitely sounds like it is of crucial importance in today's day and age with the climate crisis. We have tons of questions in the chat, so I definitely want to get some engagement here. We have a question from our Global Cafe regular Shmuel, who's asking, what, according to you, needs to be the role of state authorities and municipalities in the creation of equitable spaces for living for older persons? Thank you.
You mean on the government side, in the public sector?
Yeah, I think so.
Mm-hmm. Oh, it's very hard. In Ontario, there's the Ministry of Long-Term Care, and it is very hard for them to move forward. And it's just very difficult. It's for many reasons. And they're rethinking now their 2015 guidelines, the minimum standards for long-term care homes. And they wanted to issue an RFP for architects or were architects working with university researchers to revisit the standards to update them. And one of two areas in particular really need to be updated very urgently. The literature, the evidence-based research and design literature in environment aging, especially since COVID, all points in one direction to the need for private rooms in long-term care homes with private bathing hygiene facilities, or at most two in a room. And the province of Ontario is still stuck on the minimum a semi-private room. They won't accept the idea of private rooms. And they still operate a number of homes that have four residents in a bedroom. And this was a huge problem in COVID for the lack of personal distancing, and it was a global problem. And this is why the mean age of fatalities from COVID was high. It was in the 60s, wasn't it? The mean age, or late 50s of fatalities globally. And just basic things like this, they need to revisit and rethink. But they seem so resistant to it because it's a cost issue, because it's going to cost more to build everyone a private bedroom. They think it's a waste of taxpayer dollars. So what do you do in a situation like that? it's very hard to get them to change their mindset. Even though the evidence-based information says private rooms are healthier,
Right.
they're better from a psychological standpoint, they allow for greater personalization, just aside from a disease transmissibility issue.
Yeah. Yeah. No, thank you. Thank you so much for that. And Ken, I do see your question in the chat here and your hand raised. Do you want to elaborate on your question there?
Most definitely. Oh, I love
Mhm.
hearing your conversation, Stephen. Thank you. We're in the process of creating affordable seniors housing in our community. And we purchased a school and we're converting it into affordable housing because it's a fabulous model as far as we are concerned. But trying to convince, as you've just indicated, trying to convince the powers to be that this is a good idea, and we can do it in our situation, we're looking at $250,000 or less per unit, per door, per one housing unit.
Mm-hmm.
What's your guesstimate on the cost of the design of a
Oh, it's hard to estimate.
seniors? I know it's hard, but you must have built them before.
Mm-hmm.
I know that to build a normal apartment with no senior qualities, turning radius, handbars, wider doors, lower countertops. If you just build a regular apartment, it's like $500,000, $500,000 per unit, per door.
Right.
And
Well,
so
it,
I know I know to build seniors housing or affordable housing, it costs 20, 30% more to build them that way. So you're talking seven, 800, and that's why I
yeah.
think, as you indicated, the government isn't going to do it. They just because there's no payback. There's no
The-
way you can collect that.
that's right. So, and
And
they
now,
say, well, we need more land. We need to put as many beds as possible on each site in order to build these 30,000 beds in Ontario in the next however many years they want to do this. And so it's very hard because it's usually, they say the land costs so much unless they can develop a partnership with a local municipality, the municipal public-private partnership maybe, or with a local government that might donate the land, which can help a lot with bringing the cost down per unit. It's very hard. And
yeah.
so the pressure is to put as many beds on the same site as possible for the least amount of money.
And
This
Stephen, you
is
know what?
and this fights, this is directly against the Ontario Association of Architects. In fact, in the middle of COVID, I received a $50,000 grant from the Ontario Association of Architects to look at these very issues, to help, and we put together a white paper that's on the site for the Center for Design and Health Innovation at the University of Toronto. And I would invite you all to visit the homepage for the Center for Design and Health Innovation. It's University of Toronto, and there's a white paper there that was done for the OAA 2 years ago, and it's on redesigning long-term care architecture in Ontario and beyond, I think is the title. And it has 25 case studies from around the world that are evaluated. It has 50 design recommendations, and it has an annotated bibliography that has direct links to the source articles, which is a very rare thing. You can go to the bibliography and link to the source material, which isn't possible with the paper book, a hard copy book, obviously. And these issues of policy and cost are addressed in that white paper because the architects are really flummoxed, and they feel like they are running into a lot of impediments from the government. And it comes down to cost, cost, and cost.
But Stephen, that's something that we have addressed. I really want to have a longer conversation later with you, because we could. The funny thing is, all of those issues that you've addressed, be it space, land, building, building design, there's 1,000 vacant schools in the province of Ontario, 1,000,
Mhm.
and they averaged they average 500,000 square feet per building, and they're all slab on grade, terrazzo floor, fabulous steel buildings with cement block infill. They're wonderful facilities, easy to modify compared to most buildings because there's no stairs, because they've been built initially in their design for wheelchair access and fire resistant and on and on and on. So but trying to still convince them that, I mean, as you know, if we can build it for $250,000 a square foot, and that includes keeping a gymnasium, you know, because the biggest problem in design, I think, that is never approached is loneliness. But I would love to have a longer conversation, so I put my contact in there. Thank you.
Thanks, Ken. And yeah, hopefully you guys can connect after this as well. That's lovely. We do have a question here from Kara who says, wondering if you could share your thoughts on how older persons can be included within the architecture process / education of future architects. Are there examples of participatory design with older persons or persons with disabilities that you could share?
There have been some great studies of this, and it involves focus groups and usually with discussion sessions, sitting around a table. And it might be sometimes surveys, although residents tend to be resistant to surveys, paper and pencil surveys, but a guided interview from someone who can fill out the responses or code them on a laptop or something is a really great way to obtain information. Another important way is to show them photographs of options. Like, for instance, if you, I'll hold this up, these images. Can you see some of, I know they're really small.
A little bit, yeah.
You can show them pictures and say, what do you think about this? How would you rate it on a 5-point Likert scale?
Interesting.
Not satisfactory to very satisfactory. Or how much would you like to live there? Not at all to very much. And you can use photographs, and photographs are a great way to communicate with older persons, because if it's the photographs, as they say, is worth 1,000 words. And so you show them images, and then they can respond. I've had great success with this. Like, this is the village at Langley in British Columbia, which is a greenhouse based upon the North American model called the greenhouse, which are small residential clusters. And so you could ask them, how much would you like to live in a building with a small residential cluster like this of 12 to 14 beds per residence that are all connected? And you can ask them on a 5-point scale in different ways, and or different criteria. How easy do you think it would be to navigate, or how much would you like to be able to entertain friends and relatives and grandchildren in this type of a space versus another type? And you show them the photographs and they can answer very quickly. So there's been a lot of research on that from that standpoint. And I just happen to have a lot of examples. I could show you and talk to you about some of these and how this can be used in research. Photographs are very helpful in evidence-based research in environment and aging.
Thank you so much for sharing that. Yeah, and hopefully that answered your question there, Kara. And again, if you want to be put in contact, we're welcome to do that as well. Cynthia, you have a great question here. Do you want to unmute to read your question there?
Oh, sure. It really stimulated some good thoughts today. But listening, I'm hearing, just given the longevity of our population and the issues of where to live and where people want to live and are able to live, I just wonder in this process if we're not going to continue to just label the growing older population has all these needs, as opposed to transforming the built environment to one of all ages. And I'm thinking of schools where young children who are disabled need accessibility, environments where people live, parents with strollers, making the case that it's a life course perspective. And, you know, I remember breaking my own leg and discovering how difficult it was to navigate, just like you did with your students. But my fear is we have the imperative of the celebration of aging and long life, but functionality is really what the issue is. And if from a policy perspective, we can make it that all buildings, communities should be accessible and can be designed beautifully, do we not do a better job to help? Otherwise, I fear we're just continuing to promote ageism. All these old people need all this stuff, and it's just draining the budget, as opposed to moving it to what are the needs across the life course. What do you think?
Well, I remember being in graduate school and they said there'd be a coming wave of aging in society. And this is the 1980s, the late 1980s. They said aging, our society is aging. And nobody paid attention at all at that time. Nobody, the media, nobody. It was like climate change deniers, it doesn't exist. It will never happen. And now it's so different. And what we need to do is think about even zoning. The zoning laws need to be loosened up to allow for mixed use on sites so that when designing for older people, you don't recreate the same old mistakes that were made with the old nursing homes from the 1950s, 60s, and 70s, where they get pushed off to the side somewhere and they look like warehouses or like mini hospitals. They can't look at all like a hospital anymore. Those days are over, number one. And then, so they need to look as much like a home or a multifamily residence as possible. This is the future. And I call it residentialism. I've written about it a lot. And the residentialism is anti-institutional. So don't have it at all look or feel like an institution. So part of it being residential would mean that it could be blended into a neighborhood with other similar building types or compatible building types. In Europe, they're doing some really important things with mixed use, where they might blend a school on the first level with apartments for seniors above, with maybe a cafe on the roof with a roof terrace in the same building. That's not possible in North America in most cases because you have single-use zoning. Oh, you can't have a school together with seniors housing because those are two different building types and land uses. So it goes back to a land use discussion and even back to the reuse of a school. How do you rezone? It's a rezoning issue because you're zoning from institutional to, well, it's a different type of institutional use from educational to multi-housing. But mixed use is very hard. So if you could take a school and create a mixed use environment, like a daycare center with senior housing together, it becomes more blended into the community because more and more people have a reason to go there and to feel, and this counters the sense of alienation and loneliness among the elderly, feel like they're part of a meaningful community. In North America, a lot of the problem goes back to zoning. And this whole idea that the long-term care home, the nursing home, which is a totally useless term, is still the way to do this, which is all about separation and isolation.
Yeah.
It has to change.
Yep.
It is beginning to change. It is. But the laws, the legal aspects and the ethical issues are being addressed, but the legal aspects are still very hard to change governmental policy on. And this to go back to that study that I did for the Ontario Association of Architects. The whole point was to put this white paper in front of the elected politicians so that they could begin to lobby for change for older persons.
Yeah.
Thank you so much. And hopefully that answered your question a bit there, Cynthia.
But the only thing, I'm sorry if I don't mean to, I just wonder if we can't take a lesson from the disability community that in the US with the Homestead Act got passed to live in the least restrictive environment because they did not want to be warehoused with all these old people in long-term care. And what I think we're seeing today is there are a lot of us older people that don't want to be warehoused in that environment either. And whether or not we can take the lessons to be a little louder and activate communities more vocally, if that's, I think that's how the Homestead Act was achieved.
Mm-hmm. I think that I think it might be very helpful for an organization like the AARP in the United States to become much more active in terms of architecture and much more active in terms of environmental design issues and designing for aging. The field is designing for aging, environment and aging, whatever you want to call it, environmental gerontology, um, and becoming much more active on a lobbying level than they are now. It's almost like they don't really address architecture. It's a big problem. And they should have full-time people on board at their main office, or at least available as consultants to help them to lobby for these kinds of issues that we're talking about this morning.
Thank you so much for elaborating on that as well. And we are just being mindful of the time here. We are coming to a close shortly. Perhaps one last question here from Gregor, which is a good point to end us off on, I think. And he's asking, what technology do you find most inspiring, and more importantly, what technology is available now or imminently available for public application?
A technology?
Mhm.
In housing, for instance, in
Yeah,
particular?
technology in promoting age-friendly environments, or Geron tech for sort of age-friendly architecture.
Well, the building, you know about smart buildings. You've all heard the term. The smart building movement is about having the building do more and more for you, like turn the lights on and off, regulate the temperature, monitor maybe closed circuit cameras on site, create a safer environment to make sure the environment is safer and more manageable. And inside the home, lighting, the lighting technology has advanced a lot with fiber optics. And there are different types of window screening devices that could be operated electronically so that they don't have to be manually operated as much. And I have a colleague at Cornell University who's working with actually walls that could move and to make a 2-bedroom apartment a 1-bedroom, to make it a larger bedroom, or to have walls that break away and remove. And kitchens that are more you mentioned, I think you briefly touched a member of the audience briefly touched on kitchen appliances that need to be rethought. Now, the problem with the technology is people who are in later life have a problem with all these digital appliances because they tend to be overwhelming or difficult to negotiate, and therefore a source of stress. And so it's very important to balance, I think, a new type of digital technology that's user-friendly to older people is needed. It might sound oxymoronic, but this is really an important concern that from manufacturers of kitchen appliances, because the technology exists to make them more responsive without making them appear to be difficult to operate or scary to use. It's a delicate balance, but I think it's possible. And these are just a couple of the areas. And then there are also ramps that can change, and railings that can lightweight through the use of lightweight materials that to make ramps and other types of accessibility devices more flexible. cheaper and easier to install and change as needs change. So these are just a few of the areas in terms of the physical setting. I was going to mention, I know we just have a couple more minutes.
Mhm.
I was finishing, I'm working on my latest research right now is I was looking at cross-cultural differences between Japan and Canada in
Mhm.
long-term care housing. And I had nine, if I could just briefly mention 9 summary concepts as takeaways maybe from our discussion this morning. The first is the importance of cultural inclusivity in an increasingly diverse society. The second is functional adaptability, which goes to this issue of technology and designing for changing abilities among occupants. The third is wayfinding. Wayfinding is very important, as I mentioned earlier. The fourth is the importance of a residential imagery and not at anything at all like an institution. The fifth is the importance of carbon neutrality and critical regionalism, meaning that to make it ecologically as sustainable as possible, the building and its landscape. And also in a particular community, there might be a particular style of building, like wood or stone or particular materials that can help to make the architecture more grounded culturally in the traditions of the local community. The sixth is the importance of personal autonomy so that the individual feels independence and choice and control on their own as much as possible in the architectural setting. The seventh is the importance of environmental comfort. The eighth is the importance of person-nature transactions, because nature has been proven in the last 15 years empirically through evidence-based studies to be very important among older persons so that they have access to a garden or view, being able to open the windows, for instance, in their unit and going in and outside without unnecessary barriers. And the last one is the importance of community connections in this list. Here, this is listed from 1 to 9. And community connections means basically just don't warehouse people off someplace on the edge of town.
Mhm.
Try to find sites and integrate and use existing housing stock, which takes our conversation full circle in a way about
Yeah.
existing buildings and retrofitting them because they might have fantastic locations in walkable communities where they can actually walk to a library or a grocery store.
Yeah.
And this is the conundrum because when governments think about building new, you end up on the edge of town. When you think about adaptive use and renovating, now the possibility exists to find an older building in a great established neighborhood and to help to restore a neighborhood that might be down on its luck, to help with its
Mhm.
revitalization and even its gentrification, if it
Mhm.
can be mixed ages.
Thank you so much for sharing those larger takeaways. And we've put some resources in the chat here for people to check out. And I do want to really thank you for your time and sharing those takeaways and overall just having you as a guest today. It's been very informative and lots of engagement from everyone. So thank you for that. I would just like to take a moment to introduce next week's guest speaker and topic. So please join us next week with Dr. Kristen Jensen to discuss person-centered and family-centered training approaches for caregivers. So that will be another lovely and informative session. So looking forward to having everyone there. But thank you so much, Dr. Verderber, for being so
Thank
generous with your
you.
time today. And I think our conversation has really highlighted the importance of including older adults in every stage of the planning conversation. So thank you so much for your time and
Thank you for inviting
have a
me.
wonderful weekend, everybody.
Okay.